Hello, my name is Sarah Ziegler, and I'm a licensing specialist with the Office of Child Care within the Early Learning Division of the Oregon Department of Education. On August 14th, we issued new guidance for operating child care and other early education programs during COVID times. We're doing a series of videos to help you understand and implement the new guidance. Please start by watching the introduction video from ELD Director Miriam Calderon. The introduction video describes the purposes of the guidance and the process we use to develop it. Then, please watch the overview video. The overview video describes who the guidance applies to and the process you need to follow in order to operate legally. For example, we continue to operate under the Emergency Child Care, or ECC system, requiring licensed childcare providers and others to apply and to be approved to operate as an ECC. This video covers daily health check procedures. This is section 2 of the new guidance, and you'll find it on pages 17 to 18. The focus of this section is checking people for symptoms of COVID or exposure to COVID before they enter the childcare facility. The point is to reduce the chance of transmitting the virus between people or bringing it into the building. This is critical for everyone. We all want to prevent people from getting sick. Also, keeping the virus out gives providers the best chance of not needing to close a classroom or an entire facility, which can happen if there are positive cases of COVID among children or adults at the childcare. Some of this information will overlap with other sections: drop-off and pickup, record keeping, facial coverings, and especially the section titled Responding to Possible and Confirmed Cases of COVID. We'll have videos on each of those, so be sure to watch all of them for details. Here's the overview of the section, which we'll now show you, and you can look at as I'm speaking. You must conduct a daily health check for children, staff, and any other person coming into the program. This includes, for example, parents, educator specialists, and maintenance people. A staff member must take the temperature of all children and adults coming into the childcare. If they have a temperature of 100.4 degrees Fahrenheit or over, they must be excluded. One exception: staff may self-screen and attest to their own temperature. They would need to do this every day. You need to ask 4 questions of anyone entering the facility, adults and children. If more appropriate, ask the adult dropping off the child. Question 1. Has the person been exposed to someone with a positive case of COVID in the past 14 days? Question 2. Has the person been exposed to someone with a presumptive case of COVID in the past 14 days? A presumptive case means the person was exposed to someone with COVID and has shown symptoms in the past 10 days. Because of the exposure and symptoms, they are presumed to have COVID. If they answer yes to either question 1 or 2, the child or adult must quarantine for 14 days. The 14-day quarantine starts on the last day the child or adult had contact with the COVID-19 case. The 14-day quarantine cannot be shortened by getting a negative COVID test or by getting a note from a doctor. Question 3. Is the adult or child experiencing unusual cough, shortness of breath, or fever? Unusual cough means something not normal for this person. For example, if they have allergies or asthma, this cough might be normal for them. If yes to question 3, that person must be excluded from the program for 10 days and 24 hours symptom-free. There are exceptions involved getting a doctor's note to allow them back, or a negative COVID test. There is a lot of detail about when those exceptions apply. You will need to review the detailed information in the section titled Responding to Possible and Confirmed Cases of COVID-19. Question number 4. Does the child or adult have symptoms of diarrhea, vomiting, headache, sore throat, or rash? If yes to question 4, that person must be excluded. If cleared by a medical professional, they can return to the program. They must have a doctor's note. They must have a note from the doctor and follow their directions. If not seen by a medical professional, they may return 24 hours after those symptoms resolve. Staff members can self-screen and attest to their own health. That is up to the provider, director, or whoever makes staff decisions at your child care. If you allow it, remember they need to do this every day. And by coming to work, they are effectively certifying they've asked themselves those questions and answered in a way that they can safely come into the facility and not put others at risk. Document that a daily health check was completed on every person entering. Write down pass or fail only. Do not record specific answers or symptoms or temperature. We want to preserve people's privacy. Refer to the Office of Child Care exclusion chart while completing the daily health checks. Again, watch the video and read the detailed information in the section titled Responding to Possible and Confirmed Cases of COVID-19. Wear a face covering and a smock or other covering as required in the check-in portion of the guidance. See the section on face coverings and smocks and watch our video titled Personal Protective Equipment for Children and Adults. You will find details there. We expect that you may already have questions. We're trying to anticipate those and provide you answers. A question you may have is, what if the adult dropping off the child does not know whether or not the child has been exposed to COVID? You will need to get that question answered. The person dropping off may need to call someone who can answer that question. Another question you may be wondering is, if a parent prefers an alternate temperature taking device, can they use that? Or if I prefer that the parents take the child's temperature, can we do that? The answer is yes, as long as that happens at the entrance and the person shows you the result. The goal of this rule is for the provider to verify the temperature, rather than relying on what's being said by the person dropping off the child. These ideas meet the goal. If you have any further questions, please feel free to email them to providercontact@state.or.us. We have a frequently asked questions section on our website, and we will continue to update that with your questions and our answers. You may also be wondering what resources or supports will the Early Learning Division and the Office of Child Care be providing. We will provide a list of health screening options for handy reference, an updated daily attendance log to indicate health check results, an updated exclusion and quarantine checklist and graphic, and an updated letter that you can give to parents showing that the exclusion and quarantine rules are state requirements. If you have ideas for other resources, please send them to the provider email address that was shared earlier in the video, and we will consider them. Thank you so much for watching, and thank you for providing the nurturing care and education to children and this crucial resource for Oregon's working families.